Integrative medicine is very wide, and the tools and the interventions that we have for our patients are quite amazing. For me personally, hypnotherapy is very special. You can do a lot of things with meditations and acupuncture and herbal therapy and Reiki, but the hypnotherapy is very separate because it is a body-mind intervention, but also you can get results quite immediately. You can relieve the pain very fast. You can decrease the fear of a procedure quite significantly. So you can do things that are perceived almost impossible, almost magical, but we know it's all science behind it. There is so much research, the functional MRIs, all other imaging techniques that we have available for us, they telling it's all scientific evidence. It's not just a belief or just a placebo. It is true use of special states of our mind for healing purposes.
There are two types of patients. The patient that asks about alternative medicine therapy is usually very involved and will usually do very well with it because they're already interested before I even see them. The second type of patient that I recommend it for are usually very skeptical. Once they realize this is something that may help them through surgery or quitting smoking or whatever, they're usually willing to try. Someone like Dr. Polukhin can actually tailor what they need specifically, and it's much more effective, it's much more efficient, it works better.
I had heard of hypnosis before, previously, but I never really truly believed in it. So I decided I'd give it a shot. When I was a kid, and I used to have to get my blood drawn, for some reason it just always hurt. I absolutely hate needles, hate them. So then it stuck with me, and every single time now, blood drawn, panic attack. I had the treatment done about 2 years ago. It was successful, actually. I've gotten tons of shots, and I've got my blood drawn, and I'm actually not that bad.
In my practice, a lot of treatment involves medication that has all kind of side effects. And when you want to treat your quality of your life, you don't want to be on medications that will have more of a side effects. And that is the reason a lot of women are backing up from hormonal treatment. And it's not the women itself. As physicians, we are backing up to give them. Because the Women's Health Initiative did a big study like 12 years ago, and it came with the results that we don't need to give hormones to women because that is increasing the breast cancer risk, it is increasing the clotting problems. So we cannot easily say, oh, you're menopausal, now you're going to be on estrogen for the rest of your life, so which was in practice 20 years ago, but it's not in practice. So these women are now suffering from symptoms from menopausal syndrome, and we don't have an alternative treatment for them. And that's where down the road that the integrative medicine like acupuncture, hypnotherapy can be as a treatment option for them, because it will help them how to do behavior management for them in order to deal with the symptoms. I mean, we have to listen to the patient in order to change our management. If we don't listen to the patients, we will just do whatever routinely we've been doing. But as the patients are coming and asking for help, we need to give it to them.
We run a large cancer program in one of the main medical centers where we treat a broad range of pathologies, both malignant conditions and benign blood disorders. And so when we're dealing with people and we're trying to figure out what treatment is best for them, standard and complementary, again, we go through the basics that people may need, which incorporate surgery or radiation or chemotherapy. But also we're looking at how can we help people get through their treatments. And as most people are familiar, a lot of what we have to offer carries significant risk of toxicity. And we want to help people manage whatever symptoms may come along with their treatment while they're getting themselves better. These can range from problems like pain or nausea or neuropathy, or even things like fatigue and anxiety. So when we're evaluating people and we're trying to figure out, based on their individual circumstance, what may be best to go along with it, that's where we'll discuss some of the options that exist in the complementary medicine realm. Things like acupuncture, things like hypnosis, things like Reiki. All of these carry significant value to helping people manage symptoms on their own and getting us through the full treatment course to give them the best chance to put the cancer behind them.
I have a chronic condition with migraines that I have sought alternative treatment for in the past, and in speaking with Dr. Polukhin, she recognized the fact that I would probably benefit from her hypnosis treatments. So we sat down one afternoon and I was hypnotized and I became very relaxed, and before I realized it, our session really was over. She had put it on a disc for me to take home, and in listening to it at home repeatedly, I have found that I have actually benefited from the hypnosis therapy.
So my advice to someone who isn't sure about whether or not they want to incorporate integrative medicine principles into their practice, I would say that I see it more as having more tools in your toolbox, essentially. Like, it's comprehensive care. It's just having extra modalities available to help, if not treat the illness, you able to kind of ease suffering, so to speak. That it's kind of everybody should be following those principles. So I think integrative medicine is special because essentially you are developing a bond with the doctor. That's a little bit different from maybe a traditional interaction where you simply tell them what's wrong and they give you a pill and you leave. I think if the doctor approaches the patient in a much more holistic way, and they're learning about your background and they're learning about your family life and generally having a more broad picture of who you are, that allows them to gather more information from you and be able to treat you better because they are, they know a little bit more about what, maybe something you don't even know is going on. They can kind of pick out and be like, this, I think this is what you need to change.
What I do here at the Integrative Medicine Department is I have patients come in, I do an evaluation of them, help them to determine areas that they want to address, and then help give them resources or maybe help them with some tools that they need. So nothing that I'm doing here is invasive or scary. It's really just finding out what works for the patient, finding out what direction I can point them in, and helping them to create their own plan. I think that it's undeniable, the results and the positive influence that complementary medicine has had. I've done a lot of trainings and I've read a lot of research on it, and I'm very careful what I choose here so that it's research-based, evidence-based, and I come from that perspective as a nurse.
I think that the era of medicine where medicine is going to be person-oriented, I don't want to even say patient, but person-oriented. And I think more and more professionals will recognize it. They're looking for the tools that will help them to practice person-oriented care, person-oriented medicine, dentistry, psychology. And there are a lot of resources available for the hypnosis. And I hope that that process will speed up and people will look and seek that education, and certainly will be quite satisfied. But as a result, our patients, people who entrust their lives, the lives of their friends, family, will be more satisfied and will say, yes, it was something really special happened when I saw my doctor, when I saw my dentist, when I saw my psychologist, because that person understands me, understands what I need, and I feel better already just seeing my medical professional.